A few years ago, a patient of mine, I'll call her Margaret, 72 years old, sharp as a tack, still gardening every morning before the sun got too hot, came into my office holding a stack of blood pressure readings she'd taken at home. Her hands were shaking, not from any medical condition, but from fear. "Dr. Li," she said, "my number was 148/88 this morning. Am I about to have a stroke?" I want you to remember Margaret, because by the end of this talk, you'll understand exactly why her fear, while completely understandable, was not the full picture. And you'll understand something that took me years of clinical practice to fully appreciate. The blood pressure number that keeps a 40-year-old healthy is not necessarily the same number that keeps a 75-year-old safe. My name is Dr. Lillian Li. I'm a cardiologist, and for the better part of my career, I've sat across from thousands of patients just like Margaret. People who did everything right, who took their health seriously, and who were nonetheless confused and sometimes frightened by conflicting advice about blood pressure. Is 130 too high? Is 150 dangerous? Should grandma be on 3 medications or none? This matters because high blood pressure, hypertension, is the single most common chronic condition in people over 60. It is also one of the most misunderstood. Too many people are either terrified into overtreatment or dangerously complacent about real risk. Today, I want to walk you through what the actual evidence says so that you, or the person you love who is aging, can make decisions from a place of knowledge, not fear. 2. Introduction to the topic. So, what exactly are we talking about? Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps. It's recorded as 2 numbers. The top number, called systolic pressure, measures the pressure when your heart contracts and pushes blood out. The bottom number, diastolic pressure, measures the pressure when your heart relaxes between beats. When we say someone's blood pressure is 130/80, we mean a systolic pressure of 130 and a diastolic pressure of 80. Hypertension, simply put, means the pressure in your arteries is consistently higher than what's considered healthy for your body. Over time, that extra pressure is like water constantly running through a garden hose at higher pressure than it was designed for. Eventually, the hose wears out, weakens, or bursts. Why should you care, especially after 60? Because your risk of heart attack, stroke, kidney disease, and cognitive decline is directly tied to how long and how severely your blood vessels have been under that extra strain. And here's the twist that surprises most people. After 60, blood pressure management becomes both more important and more nuanced than at any other stage of life. 3. Medical explanation. The science behind it. Let's talk about what actually happens inside your body as you age, because this is the key to understanding why the danger zone shifts later in life. Think of your arteries in your 20s and 30s like a brand new rubber garden hose, flexible, elastic, able to expand and contract smoothly with each heartbeat. This elasticity absorbs the force of each pump from your heart, cushioning the pressure. By the time we reach our 60s, 70s, and beyond, those same arteries have often become stiffer, more like an old hose that's been left in the sun for years. This process is called arterial stiffening, and it happens due to a natural buildup of collagen and calcium in the vessel walls, along with the gradual loss of elastin, the stretchy protein that gives young arteries their flexibility. Here's why that matters. When arteries stiffen, the systolic number, the top number, tends to rise, while the diastolic number, the bottom number, can actually plateau or even fall. This creates what we call a widening pulse pressure. The gap between your top and bottom numbers gets bigger. A young person might have a blood pressure of 120/80, a 40-point gap. An older adult might have 150/70, an 80-point gap. That widening gap is itself a signal of vascular aging and stiffness. independent of the individual numbers. This is also why an older adult can have a normal, even low, diastolic pressure, while their systolic pressure is elevated, and why treating that person as if they were 45 years old, chasing an aggressive number, can sometimes cause harm rather than help. Risk factors that accelerate this stiffening process include long-standing, untreated high blood pressure itself, which becomes self-reinforcing diabetes and insulin resistance, which damage the vessel lining, smoking, which accelerates arterial damage, excess sodium intake, which increases fluid retention and vessel pressure, obesity and physical inactivity, chronic kidney disease, which both causes and worsens hypertension genetics. Family history plays a real role. Here's an analogy I use with my patients. Imagine your circulatory system as the plumbing in an old house. When you're young, the pipes are new copper, flexible enough to handle pressure surges without issue. As the house ages, those pipes can develop mineral buildup and stiffening. If you crank the water pressure too high in an old house, you risk a burst pipe. But if you turn the pressure down too aggressively, some rooms on the top floor might not get enough water pressure to function, representing the brain, kidneys, and other organs that need adequate blood flow to work properly. This is the central tension in blood pressure management after 60. Too much pressure damages the pipes over time, but too little pressure can starve important organs, particularly the brain, of the blood flow they need moment to moment. 4. Symptoms and warning signs. Here is something critical I tell every patient. High blood pressure is often called the silent killer for a reason. Most people feel completely normal, even with dangerously elevated numbers. That said, there are warning signs that should never be ignored, especially when blood pressure is severely elevated, generally systolic over 180 or diastolic over 120. Sudden, severe headache, unlike any before vision changes, blurring, spots, or partial vision loss, chest pain or pressure, shortness of breath, numbness or weakness on one side of the body, difficulty speaking or slurred speech, confusion or sudden difficulty thinking clearly, severe dizziness or loss of balance. If you or someone you love experiences these symptoms, this is not a wait-and-see situation. This warrants immediate medical attention, potentially a call to emergency services, because it could represent a hypertensive emergency, stroke, or heart attack in progress. But I want to emphasize, for the vast majority of older adults with elevated blood pressure, there are no symptoms at all. This is precisely why routine monitoring, checking your blood pressure regularly, not just when you feel unwell, is so essential after 60. You cannot rely on how you feel to tell you whether your blood pressure is in a healthy range. 5. Diagnosis and medical evaluation. So how do we actually figure out what's happening inside your arteries? The starting point is simple: a blood pressure reading, ideally taken correctly. Seated, feet flat on the floor, arms supported at heart level after 5 minutes of quiet rest, without caffeine or exercise beforehand. A single reading in a doctor's office isn't always reliable. Many people experience white coat hypertension, where anxiety in a medical setting temporarily raises their numbers. This is why I often recommend home blood pressure monitoring, or 24-hour ambulatory monitoring, which gives us a much more accurate picture of what your blood pressure looks like in real life, including while you sleep. Beyond the blood pressure cuff itself, a thorough evaluation for an older adult typically includes blood tests to check kidney function, electrolytes, blood sugar, and cholesterol, a urine test to check for early kidney damage, an electrocardiogram, ECG, to look at the heart's electrical activity, sometimes an echocardiogram, an ultrasound of the heart, to see whether the heart muscle has thickened in response to years of high pressure, a review of all medications, including over-the-counter drugs and supplements, since some can raise blood pressure or interact with treatment. We also assess something many people don't expect: orthostatic blood pressure, checking your pressure both sitting and standing. This matters enormously in older adults because a drop in blood pressure upon standing can cause dizziness and falls, which are a major cause of injury and hospitalization in this age group. This is one of the biggest reasons treatment must be individualized, rather than driven by a single number alone. 6. Treatment and management. Now let's get to the heart of Margaret's question. What is the real danger zone, and how do we treat it? For years, guidelines have evolved, and I want to give you the most current, evidence-based thinking as of today, while being honest that this is a nuanced, personalized decision, not a one-size-fits-all number. Major cardiology and hypertension guidelines generally define categories as follows: normal, below 120/80, elevated, systolic 120 to 129 with diastolic below 80, stage 1 hypertension, systolic 130 to 139 or diastolic 80 to 89, stage 2 hypertension, systolic 140 or higher, or diastolic 90 or higher, hypertensive crisis, systolic above 180 and slash, or diastolic above 120. This requires urgent medical attention. Landmark research, including a major U.S. trial that studied intensive versus standard blood pressure targets in older adults, found that treating systolic blood pressure down to a target around 120 reduced cardiovascular events and death compared to a more traditional target of 140, even in patients over 75. This was a significant shift in thinking. However, and this is the nuance that matters most, that same body of research, along with real-world clinical experience, has taught us that more aggressive targets are not automatically right for everyone. For a frail older adult, someone with multiple chronic conditions, someone prone to falls, or someone who becomes dizzy on standing, pushing blood pressure very low can increase the risk of falls, fainting, and reduced blood flow to the brain and kidneys. This is why many cardiologists, myself included, now think in terms of a danger zone that is genuinely a range, personalized to the individual, generally. For most healthy, active older adults, a target systolic pressure below 130 and ideally around 120 to 125 is associated with the best long-term cardiovascular outcomes when it can be achieved safely. For frail older adults, or those with significant other health conditions, a somewhat higher target, sometimes 130 to 140 systolic, may be safer and more appropriate to avoid the risks of overtreatment. Diastolic pressure below 60 in someone on blood pressure medication deserves a conversation with your doctor, as very low diastolic pressure can sometimes reduce blood flow to the heart itself, particularly in those with existing coronary artery disease. Treatment itself typically involves a combination of approaches. Lifestyle interventions, which remain foundational at any age. Reducing sodium intake, generally toward 1,500 to 2,300 milligrams per day. Regular physical activity, even brisk walking most days, makes a measurable difference. Maintaining a healthy weight, limiting alcohol. Following a diet rich in vegetables, fruits, whole grains, and lean proteins, often described as the DASH diet, managing stress and prioritizing sleep quality. Medications when lifestyle changes aren't enough on their own, which may include diuretics, which help the body eliminate excess sodium and fluid A-CE inhibitors, or ARBs, which relax blood vessels, calcium channel blockers, which also relax and widen blood vessels, beta blockers, in certain specific situations. The choice and combination of medications and how aggressively to treat must always be personalized, taking into account your overall health, other medical conditions, kidney function, risk of falls, and your own preferences and goals for your care. This is a conversation to have directly with your physician, not a decision to make from a headline or a chart alone. 7. Prevention and healthy habits. Prevention doesn't stop mattering after 60. If anything, it becomes more powerful because your body's response to healthy habits is still remarkably responsive at this stage of life. Practical, realistic steps I recommend to my patients. Monitor at home. A simple, validated home blood pressure cuff, used correctly, gives you and your doctor real, actionable information. Far more useful than a single office visit reading. Move most days. You don't need to run marathons. A 20 to 30-minute walk most days measurably lowers blood pressure over time. Rethink salt, not flavor. Cooking with herbs, citrus, and spices instead of relying on salt can make a real difference without sacrificing enjoyment of food. Stay socially and mentally engaged. Chronic stress and isolation are linked to higher blood pressure and worse cardiovascular outcomes. Don't skip your follow-ups. Blood pressure management is not set it and forget it. Your needs may change as you age, and regular check-ins allow your treatment to evolve with you. Stand up slowly. Especially if you're on blood pressure medication, giving your body a moment when transitioning from sitting or lying down to standing can prevent dizziness and falls. 8. Common myths and misconceptions. Let me clear up a few things I hear constantly in my clinic. Myth: if I feel fine, my blood pressure must be fine. As we discussed, high blood pressure is usually silent. Feeling well is not a reliable indicator. Myth: blood pressure naturally goes up with age, so a higher number is normal and doesn't need treatment. While it's true that blood pressure tends to rise with age due to arterial stiffening, common does not mean healthy. Elevated blood pressure at any age carries real cardiovascular risk, and treatment, appropriately tailored, meaningfully reduces that risk. Myth: lower is always better, so I should get my numbers as low as possible. As we discussed, this isn't quite right, especially for older or frailer adults. Overly aggressive treatment can cause dizziness, falls, and reduced organ blood flow. The goal is the right number for you, not the lowest number possible. Myth: once I start blood pressure medication, I'm stuck on it forever, so I should avoid starting. Some patients do need lifelong treatment, but others are able to reduce or adjust medication over time through sustained lifestyle changes, weight loss, and other improvements, always in partnership with their doctor. Avoiding needed treatment out of fear of being stuck on pills allows ongoing, silent damage to blood vessels, the heart, kidneys, and brain. Myth: blood pressure medications are dangerous for older adults. When properly selected and monitored, blood pressure medications are among the most well-studied, safest, and most effective tools we have in cardiology. The key is thoughtful, individualized dosing, not avoidance. 9. Doctor's advice. If there's one thing I want you to take from this conversation, it's this. Your blood pressure target after 60 is not a single universal number. It's a personalized conversation between you and your doctor, one that takes into account your overall health, your other conditions, your risk of falls, and your own goals and values. I don't want you to leave here afraid. Fear doesn't lower blood pressure. Knowledge and action do. What I want is for you to leave here empowered, to check your blood pressure regularly, to bring your home readings to your next appointment, to ask your doctor directly, what is the right target for me, specifically, given my health? And to understand that this is a legitimate, important question, not an inconvenience. Remember Margaret, from the beginning of this talk? Her reading of 148/88 wasn't, on its own, a crisis. What mattered was the full picture: her overall health, her other readings over time, her risk factors, and her goals. We worked together, adjusted her treatment thoughtfully, and years later, she's still gardening every morning. That's the goal. Not fear, not perfection, but partnership with your own care. So, how high is too high after 60? The honest, evidence-based answer is, it depends on you, your overall health, your body's response, and your personal risk factors. But here is what is universally true. Awareness, regular monitoring, honest conversations with your doctor, and consistent healthy habits are what protect your heart, your brain, and your independence in the decades ahead. Blood pressure management after 60 isn't about chasing a perfect number out of fear. It's about understanding your own body well enough to make informed, confident decisions, in partnership with a doctor who knows your full picture.